I'm Tara Chandran. I'm a breast surgical oncologist. I'm here to discuss the two main types of breast surgeries and what to expect during your post-operative recovery. The main surgical options for breast cancer are anywhere from a lumpectomy, which is when we remove a small area of clean tissue without cancer around your actual cancer. And the other is a mastectomy, where we take out the entire breast and leave your skin behind. And within the mastectomy, there are different types. There is the simple mastectomy, where we take out the breast tissue plus the nipple, and we leave you with a flat aesthetic closure so that you can easily wear a prosthetic bra. The other option is a skin-sparing mastectomy, and that's often used when patients want reconstruction afterwards. And then there's the nipple-sparing mastectomy, where we actually don't take out any skin and we leave the nipple behind. And that's an incision that's usually right under the breast tissue. I think a lot of the discussion has to first prioritize the patient's cancer. Not every surgery will work with every type of cancer. For a lumpectomy, what we like is we kind of look at the size of the tumor and in relation to the patient's breast. We want to make sure that we get all the cancer out, but we also want to make sure that we don't have a huge defect and the patient's not miserable looking down at their breast. We want to make sure that you're happy with the result. So anybody who's interested in reconstruction, we make sure that they talk to a plastic surgeon and make sure that both the plastic surgeon and me will work together and try to figure out what's best for the patient based on what they want and also what's best for their cancer care. So reconstruction is something that we talk about during the first consultation itself. This is so that we can figure out what surgery I'm needing to do, what incisions I'm going to use, and also just make sure that we have a complete plan of what we're going to do surgically going forward. There's a lot of different options for reconstruction. One is what we offer called a flat aesthetic closure, which means that the chest wall is completely flat. And these are women who would like to do prosthesis afterwards. We can also do a lot of reconstruction options, such as implants. Recovery for a lumpectomy is shorter than a mastectomy. Most people will start to feel about normal in, let's say, 2 to 4 weeks. Sometimes with a mastectomy, things can be longer, 4 to 6 weeks, and each patient is different. So we have very clear guidelines on what patients are allowed to do after surgery and what not to do. We make sure that their pain is well controlled after surgery, and they're always available to contact me if they have any questions throughout their post-operative process. We hope that their biggest support system will be us, but we know how important it is to have family members and friends, whatever that looks like to you, be there. So that's why I really want and encourage patients to bring their family members, their friends, even people that can't make it, have them on the phone, just whoever is available, because sometimes it's just so much information that they're getting. It's really important for them to be relying on whoever it is that can support them outside of our clinic as well. There's no question that's too small or unimportant. I want them to know that they can always ask anything that they need from me or the rest of the team here, and we're here to help.